meeting people where they're at, having realistic expectations, not being punitive is really important. Um, Knowing that it's a chronic disease, it's got many different facets to it. It's not cookie cutter. We are really big about same day access to services as best we can. Because COVID hit and a pandemic hit doesn't mean that substance use disorders stopped. The day they reach out for help, if we can capture them in that moment, that's a huge step in the right direction. And that's a huge step for them to be able to ask for help. The use isn't going to stop if they have an appointment in a week. And each day that goes by, a person's life is at risk. And we're really lucky here that we have a huge team of folks. So it's not just the medical part, it's the recovery support navigators, it's behavioral health, it's medical, anybody that we can help folks kind of come back in and just wrap around them.
During COVID, in the beginning, the shift was a little difficult. We didn't know what to expect or how it would really work out with our patient population. However, it actually has been phenomenal. Our patients really love being on the phone with us, and we are able to continue care for them regardless of the pandemic going on. We're safe at the clinic, as well as the patients are safe in the comfort of their homes or whatever setting they may be in. And we're still able to follow up with them and touch base with them periodically. There were some of our population that did not have phones and were unable to contact via phone, but Duffy had programs and obtained phones for those folks who needed them. And then it was just like a 24-hour process, and the patient had a phone and we were able to engage with them. I find it very effective just because we're able to touch base and continue with the care that they need. Some people need to be just called every twice a week just to make sure they're on the right track or that they're feeling okay. And that's something that we can do. And whatever barriers each person may have had, we've done our best to get over those barriers and get this patient a phone or anything they might have needed in order to stay in touch with them during this time.
A lot of our street homeless people, to shower or something, they would go to like the gyms or to the public showers at the beaches and things like that. And so just that basic needs stuff shut down during the pandemic. So we started an outdoor shower program where we had the shower trailer, and that really became a huge success. In the beginning, it was people kind of showing up just for showers, and really what it turned into is the street homeless community knew that they could come to Duffy Monday, Wednesday, and Friday and speak to a case manager or recovery support navigator, and we built personal relationships with these people, and they're people that had known about Duffy before, for the most part, the majority. But we got to connect with them, way more through this help calling unemployment or applying for like food stamps or calling treatment centers if that's what they needed. And, people would just show up too to say hi and like see how things are going or tell us about what's going on in their life. And then through that rapport, they would come back if they needed something or are comfortable coming to us and saying, this is what's going on, I need help with this. So it really turned into something we hadn't quite expected. The whole Duffy team has been really great about when people show up, still being able to like make it work by meeting them outside or something. If they have like, someone will show up and there's like something wrong with their foot, or they have sores and things like that. The team will come out, or we'll have a provider come out or something and assess that need. Surface level, it was like we were providing basic needs that weren't as easy to access anymore. And it was just another point of connection to, check on people's health and provide our services.
When we shifted because of COVID, One of the programs that I was integrally involved with was the breakfast program. And there, case managers, myself as a spiritual care provider, other places, other people from other agencies met people on the street and offered them a breakfast. But it was so much more than feeding people, because that is an absolute basic need. And we get that. People can't function if their basic needs aren't met. So making sure that they had food, had that warm breakfast to start the day with. We had cars full of socks and blankets and gloves and sweatshirts, making sure people were warm and had the clothing that they needed to sustain whatever their living conditions were. And then we were just there to talk with them. We weren't there again to have any particular goal met for them unless they came to us with something. But there were people that would show up every morning just for that connection. They can bring things to us and we're not going to judge them. They can bring things to us and we're not going to shame them. You know, we understand there are do-overs in everything that we work with. There's do-overs when you're dealing with substance use. There's do-overs when you're dealing with your own physical health or mental health or spiritual health. And we're right there to meet people where they are, no matter where that is from day to day, and work with them to move in the direction that they're wanting to move in. Studies show that if people know that they're cared about, they will be better at taking care of themselves. And so just the way that we outreach and connect with people helps them to want to do more to keep themselves healthy, mind, body, and spirit.